Hi everybody, so today we will be talking to you about the first article, Learning from Crowdsourced Labeled Data, a Survey. So crowdsourcing is when companies break up a large project into smaller tasks and let large groups of workers work on completing these smaller tasks. Once all the tasks are complete, they put all the work together to finish the initial project. So labeling is used to map features of an object to more advanced concepts using human intelligence. So label quality is the accuracy that labels from crowdsourced labeling match their true value. True labels come from experts who have perfect labeling quality, and noisy labels are labels that do not reflect the object's value, and removing these from the dataset can improve the quality of the data. Learning model quality is the prediction performance of a learning model trained by crowdsourcing dataset through a learning algorithm. One way that the quality of the learning model can be improved is to improve label quality by reducing the amount of noise present in labels.
Ground truth inference is defined as a process of estimating the true label of each example from its multiple label set. We cannot rely on single labeler's decision due to human error or bias. We use algorithms to determine true label from multiple label sets. Algorithm examples. Majority vote MV is a simple but an effective method for a binary case. If more than half of labelers provide negative labels, the integrated label will be negative and vice versa. If the numbers of both kinds of labels are the same, the integrated label will be randomly determined. Expectation maximization EM algorithm is an important mainstream general method that conducts inference in probabilistic graphic models, multi-class or binary. In Section 4, the authors discuss current learning models and how they are built and adjusted. I learned that having good ground truth inference and high-quality labels determine how useful the learning models are. The models are built using the crowdsourced label data, so the models can most accurately label data in instances similar to those used during the crowdsourcing. Therefore, the models are not universally applicable. While I do not understand the complex algorithms, I understand with increasing complexity, the algorithms creators are improving the learning models by adjusting for uncertainty and incorrect or noisy labeling. One concern I have is that the learning models can be biased based on the sample datasets selected to create them. And in the active learning models, the labelers can be chosen, adding a further chance of bias based on the system selection of labelers. The authors of this article also note that removing incorrect labeling to improve the models is more efficient than correcting the incorrect labels.
Hello class, my name is Romik. I'm going to be talking about data sets and some of the key takeaways I got from reading this section. In this section, they were talking about how there's different tools and algorithms to sort through data sets and how each of these has its own advantages and disadvantages depending on what you're trying to get done. Some key improvements I noted as I was reading this section was cleaner data, better learning models, and more efficient algorithms. But I think out of those three, the most important improvement would be having cleaner data, because no matter how efficient your algorithm is, if you don't have clear data, you're not going to get the results that you're looking for, and they're going to be skewed and not be as clean and clear as you want it to be.
Hello everyone, my name is Dennis, and today I'll be talking about the healthcare prediction algorithm biased against Black patients. So this is a study that involved the racial bias and how it extends to the software widely used in healthcare. So the study found that the software program that determines who gets access to higher risk healthcare was letting healthier whites into the program rather than blacks. So this algorithm encodes for racial bias by using healthcare costs to determine patient risk. I learned that if fixing this, the bias in the algorithm were to have routine audits, could more than double the number of black patients admitted. Instead of being trained to find the sickest patient, the algorithm ended up being trained to find those who can spend the most money, to whom this becomes mainly a business. And in my eyes, instead of helping people in needs, it's really just helping those in need who have the most money. So we really want to focus on a holistic approach, helping Americans get better. We should mainly focus on changing the whole system rather than an algorithm just to admit everyone equally.